Hi, this is Sanjib Debray and this is part 1 of the module regarding stress and heart disease as a part of stress and illness. In this module, I will talk about what is heart and how does the heart circulation works in a human body. I will talk about different types of blood pressures and their measurements, heart disorders like high blood pressure and heart attack, angina and stroke with their respective features, causes, diagnostics and preventions. However, to keep the video to a reasonable length, I will include the angina and stroke with their respective features, causes, diagnostics and preventions in the next part of the same module. Let's start with this video to understand that heart disease is heartless and it strikes without warning.
Dad, what are you doing here?
I can't come home tonight.
But what about football?
I'm not going to be around anymore, so
When are you coming back?
I'm sorry.
I don't understand that.
You look after your mum.
Dad,
Bye, Ben.
Dad,
Ben, can you come with me, please?
The video says it all. So what is a heart? The heart is composed of specialized cardiac muscle and it is four-chambered with a right atrium and ventricle and an anatomically separate left atrium and ventricle. The heart is thus functionally composed of two hearts, the right heart and the left heart. The right heart consists of the right atrium, which receives deoxygenated blood from the body, and the right ventricle, which pumps it to the lungs under low pressure, and the left heart consisting of the left atrium, which receives oxygenated blood from the lungs, and the left ventricle, which pumps it out to the body under high pressure. Now let's see how it works. Dark bluish, that is oxygen-poor blood, returns to the heart after circulating throughout the body. It enters the right atrium. Then it goes to the right ventricle. The right ventricle pumps blood under low pressure into the pulmonary artery through pulmonary valve. From there, the blood goes to the lungs, where it gets fresh oxygen. Oxygen-rich blood is bright red. Now it goes to the left atrium. Then it enters the left ventricle. Then into aorta, which takes the blood from the heart to the rest of the body. The cycle repeats as the blood flows back the right atrium. A stressful situation sets off a chain of events. Your body releases adrenaline, a hormone that temporarily causes your breathing and heart rate to speed up and your blood pressure to rise. These reactions prepare you to deal with the situation, the fight and flight response. Let's talk about some facts and figures about cardiovascular disease worldwide. The slide here shows that cardiovascular disease is the world's #1 killer. 17.8 million deaths happen every year from cardiovascular disease. It is the cause of 31% of all global deaths. About 75% of cardiovascular disease-related deaths take place in low and medium-income countries. The human heart, which is considered to be the most dependable pump in the world, in average beats 70 times in a minute, and that's about 100,000 times each day, which is more than 36 million times a year and 3 billion times in a lifetime in average, as per WHO, World Health Organization. The heart is about the size of a fist and is located close to the middle of the chest and weighs between 7 and 15 ounces, which is less than approximately 4 medium-sized bananas. Are stress and heart disease related? Does stress increase the risk of heart disease? Stress is a normal part of life, but if left unmanaged, stress can lead to emotional, psychological, and even physical problems including heart disease, high blood pressure, chest pains, or irregular heartbeats. Heart disorder. The cardiovascular system is composed of the heart and blood circulation system. A major risk factor for heart disease is hypertension, which is high blood pressure.